Hello friend, now the topic we are going to discuss about vocational sanitation at school complex. So what is sanitation? Sanitation can be seen as a policy and practice of protecting health through hygiene measures. In the view of the World Health Organization, sanitation generally refers to the provision of facilities. It has been realized that improving sanitation is known as significant impacts on health both in household and across community. Sanitation refers to all conditions that affect the health of people in a geographical area. This should be maintained in good condition. Basic sanitation is described as having access to facilities for the safe disposal of human waste like feces and urine, as well as having the ability to maintain hygienic condition through services such as garbage collection, industrial hazardous waste management, and wastewater treatment and disposal. Through the world, an estimated 2.5 billion people lack basic sanitation, more than 35% of the world population. Basic sanitation is very important in all places and environmental, especially schools. So school sanitation. School sanitation refers to hygienic practices that occurs in schools. School sanitation and hygiene education as the combination of hardware and software components that are necessary to produce a healthy school environment to develop or support safe hygiene behavior. So the hardware components: supply of drinking water, hand washing, safe disposal of excreta, solid waste management. Software components promote hygienic conditions, practices of school staff and children, prevent water, sanitation related diseases and parasites. Poor condition of sanitation in school environment will have certain negative influences on learning. Problems in school sanitation: waste disposal, refuse disposal, as well as inadequate water supply are problems in our environment, especially in institutions. It caused by a lot of factors. These include neglect of the operation and maintenance of health facilities, lack of hygiene education for the students, non-existent or influences water supply, poor sanitation and inadequate hand washing facilities, dirt and unsafe water supply, toilets or latrines that are not adapted to needs of students, as well as unhealthy and dirty classrooms, school compounds. Diseases related to poor sanitation and water availability causes many sickness like cholera, diarrhea, malaria and typhoid. All these diseases generally affect the health of students. Students cannot even learn properly because they are sick. Even learning in unhealthy environments leads to students not even understanding what they are being taught, and in extreme cases it could lead to student mortality. It not clean on the extent in which school management have contributed in curbing poor sanitation practices. A lot of literature available talks about environmental sanitation strategies, but most of them have been done in wider communities and not in institutions of learning. Purpose of sanitation courses: identifying the causes of poor sanitation practices, identify the effect of poor sanitation practices, ascertain the ways in which the school management have contributed in providing facilities that will enhance sanitation practices. Find out the strategies that could be employed to enhance sanitation practices among students. Find out the ways to improve the even better sanitation environment for the students and educate them sanitation practices. Problems in school sanitation needs: the methods need to adopt students to undertake hygiene education. More health workers should be trained to include sanitation practices counseling into their consultative with parents. Management should source for more funds from local and international levels, which would be used for providing sanitation facilities. Recommendations: The school management has to ensure that the various ways of improving sanitation within the institutions are used in synergy instead of in isolation. Due to fact these methods are all important. The government at all levels should provide the necessary funds needed by the school management to ensure the procurement of various facilities, equipment needed for students to live in a hygienic environment. The school management have to ensure that those in charge of cleaning the school environment are adequately monitored so as ensure they discharge their duties properly. The provision of safe water, sanitation and hand washing facilities. The provision of safe water and sanitation and hand washing facilities, it is first step towards a healthy physical learning environment. However, the mere provision of facilities does not make them sustainable or produce the desired impact. It is use of the facilities, the related hygiene behavior of people that provides healthy benefits. In schools, hygiene education aims to promote those practices that will help to prevent water and sanitation related diseases as well as healthy behavior when the children become adults. The combination of facilities, correct behavioral practices and education are meant to have a positive impact on the health and hygiene conditions of community as a whole, both now and in the future. UNESCO has estimated that more than half of the world's schools lack clean toilets, drinking water and hygiene lessons for all school children. Safe water and sanitation are essential to protect children's health and their ability to learn at school. A fact dramatized by tsunami catastrophe which turned the spotlight on global water and sanitation crisis affecting more than 2 billion people. In this sense, safe water and adequate sanitation are vital to a children's education as a textbook. The availability of clean water, adequate sanitation and hygiene education has a profound impact on health of children, on learning, the teaching environment and on girls' education. It is directly related not only to physical, mental and social health but ultimately to economic and political development. Indeed, the campaign for safe water and sanitation in schools will bring the world much closer to achieving 3 of the 8 MDGs, the goal of university, primary education, environmental sustainability and particularly the record on providing safe water and sanitation and hygiene education is dismal despite the efforts of many stakeholders over the past decade, from governments to development agencies to communities. And yet there are rational, economic and humanitarian reasons for ensuring safe water, adequate sanitation and its corresponding hygiene educations in schools. Diarrhea disease, intestinal worms and other disability parasites affect appalling number of school children. About 40% of the estimated 578 million school-age children are infected with worm and 88 million children under 15 years of age. Such disease burdens, especially between the age of 5 and 14, a period of intense physical and intellectual development and has a negative effect on growth, nutritional status, physical activities, cognition, concentration and school performance. There is a growing body of scientific evidence that highlights the critical importance of a early year and cumulative nature of deficiencies that children can suffer if they do not get the best start in life. Good health, nutrition and development in those early years set the stage for learning potential in latest years. Safe water, sanitation and hygiene care practices are essential to ensuring the children get the best start in life, that they are able to enter school health, alert and ready to learn. In fact, interventions that focus on improving hygienic practices seems to having the greatest impact, followed by improvement in water quality, sanitation and water quantity. The link between hygiene promotion and hygiene education. The purpose of both hygiene education and promotion is through the widespread adoption of safe practices related to sanitation and water to prevent diseases like diarrhea, skin and eye infections and worms. There is of course overlap between the concept of education and promotion. Moreover, most programs use both education and promotion approach. Hygiene promotion identifies and use messages about the what people know, do and want. Simple, positive and attractive messages are delivered through the most popular local ways of communication. Hygiene promotion usually takes place in the community, particularly through information, education and communication activities such as campaign, wall writings, parades, but also through interpersonal communication such as home visits. In well-planned promotion activities, different messages are identified for men and women, children, young and old, and for different ethics and economic groups. Hygiene education helps people learn about water and sanitation related behaviors and the reason why this leads to good health and bad health. It also examines the social context of hygiene practices. The idea is when people understand and think together about their situation and practices, they can plan and act to prevent diseases. One important actual situation for hygienic education is working with the children within the classroom. Key hygiene behavior for school children's safe use of toilets and urinals. Diarrhea and worm infections are two main health concerns that affect school-age children on a large scale, and that can be improved through appropriate toilet and urinal use. Diarrhea causes children to lose too much fluid and essential nutrients from their bodies. This results in serious illness and sometimes even death. This cause of diarrhea includes a wide area of pathogens. Worm infections are spread through unhygienic environments, soil or water, and unhygienic behavior through food or hands. The most common type of worms are roundworm, wipeworm, hookworm, pinworm, and tapeworm. Worms are parasites that destroy the tissues and organs in which they live and can cause pain, diarrhea, intestinal obstruction, anemia, ulcer, and various other health problems. The baseline studies of schools are useful for planning at the beginning of the program and monitoring at large stages. The purpose of baseline study is to build on current strengths and get information to make plans that will prevent or solve problems. In school programs, similar challenges appears again and again. Therefore, such a small survey will usually give sufficient information for planning. A sample of 10 to 20 schools in different parts or a district is usually sufficient, but it can also be used for an individual schools. We can improve the sanitation through conducting many programs, awareness camps and films, and make them to practice.